Dr. Yanal Salam.
We do have, unfortunately, worldwide, a number of deaths due to these conditions.
Do they know that it can cause like a long-term problem to your health?
Anything that affects your immune system can make you more predisposed to complications.
Oh my God. Welcome to No Plan Go podcast. Khaleej Times in association with Pfizer will tackle important tips on how you can protect yourself from respiratory illnesses. Dr. Yanal Salam, you're the head of internal medicine at Emirates Jumeirah Hospital. Can you tell me briefly about what is internal medicine?
So a lot of people have a bit of misconception about internal medicine. What it really is another name for it is general medicine. So we are specialists in the general health of the adult population. So we see patients starting 16 and above. We treat them for pretty much everything. If something is very complicated and it needs specialist care, we do refer them to a specialist such as a cardiologist or a pulmonologist, which means a lung doctor or a heart doctor or whatever the patient needs.
Today we're going to talk about viral infections and respiratory illnesses. As winter season is coming, how can this illness affect families and communities? And what are those type of viral infections?
So this is the hot topic, or let's say cold topic now with the cold. So these viruses are mainly such as influenza, adenovirus. There are multiple viruses. We see them a lot now with the change of weather and getting into cooler times because of many factors. First factor is that the weather becomes drier and viruses thrive on cold and dry weather. In other countries, maybe in the UAE, we like to go out more in the cold, but in other countries, they stay at home, so it becomes more crowded environment. If they turn on the heater, again, that creates a dry environment in the house.
That's very true.
So they are more prone to infections. The temperature itself has nothing to do with you having a higher chance of infection, but as we said, the viruses thrive in this higher weather. It might be distressing for a lot of people. Maybe we were discussing a moment ago that every one of us has a bad experience with these viruses. Even what we call as medical professionals mild illness can be very distressing for the patient because they have high fever, a cough. They feel really bad during these times.
Do you think people, do they actually know what do they have? Do they know that it's influenza A, influenza B, or any other thing, and they just take whatever they have at home as a medicine to get better?
So generally people treat themselves at home. There are a lot of home remedies, ginger, they take Panadol, things like that. I think when now people are having more of a culture of seeing a doctor, even if they're having mild symptoms, it's good practice for one reason. If you're having symptoms that are distressing you, is to know what type of virus you have. For example, if you have influenza, then we have a treatment for influenza called Tamiflu. So
the other like antibiotics don't work with
Yes. So if we talk about antibiotics, we talk about bacteria. So sometimes when you have a viral illness, it can you can have a superimposed bacterial infection, and then the doctor will prescribe you antibiotics. But for things such as influenza, you have an antiviral.
Yeah.
Okay, such as Tamiflu. What Tamiflu does, it cuts the duration of illness. So you feel better faster, technically.
All right, so I want to ask you, what are pre-existing and like old medical conditions that someone has will make it more riskful for them to get respiratory illnesses?
So anything that affects your immune system can make you more predisposed to complications of these viruses, such as diabetes. We have a lot of diabetics in our population. If you have hypertension, any rheumatoid conditions, if you're taking any medication such as corticosteroids that might suppress your immunity, and very importantly, cardiac and heart conditions.
I was gonna ask you about this as well, about like if this can affect you on the long term, especially if like can it cause like a cardiovascular problem or something like that?
So on the long term, for influenza specifically and adenovirus, it shouldn't cause any problems. We do have some cases about what we call myocarditis, which is inflammation of the wall of the heart, let's say, in the muscle of the heart. Sometimes when you have the acute illness, it can raise the chance of you getting a cardiac condition, a heart attack. And the problem is, if it falls to your lungs and it becomes a bacterial infection, then you got all sorts of complications that can affect the heart, such as atrial fibrillation, which is a type of abnormal electricity in your heart.
Oh my God. So, I mean, not a lot of people know that. Do they know that it can cause like a long-term problem to your health?
Yes, so people deal with flu, we call it the flu.
Yeah.
All right, so the flu for us is just a day-to-day thing that you get. But sometimes for these critical patients that are immunocompromised and have immune problems, it can be a big deal. And we do have, unfortunately, worldwide, a number of deaths due to these conditions.
So how do I know, like, what are the symptoms? How do I know that I'm facing a respiratory illness, or is it something else that has nothing to do with it?
So once you feel the cough is getting worse, you're having a cough, it's getting worse, you're beginning to have chest pain, shortness of breath. If you have a spirometer which measures the oxygenation in your blood, if it's falling under 95%, then you should visit a hospital, do an x-ray, and check that you have not developed pneumonia or respiratory illness.
So after having the disease, after having the illness, if you take the vaccine, would that help? Or you should take it before you get it?
No, you should take it before, because it's a preventive measure.
But if you take it after, it will do nothing. It will not prevent.
No, what's done is done.
Okay.
But
so people should take the vaccine before today.
Yes, absolutely. So usually influenza vaccines are distributed around between August and October of every year. So right before what we call the flu season.
So let's say I have the symptoms today. What measures should I take? Should I go see a doctor, go to the hospital? What should I do?
Go to a doctor. If they feel that you have lower respiratory tract symptoms, you should do an x-ray. But even if you don't have that, they do a swab to check if you have influenza A or B, and then they can give you Tamiflu medication.
What about age range? Is there an age range? Like kids, do they get it? Older people more?
So there's something we call the extremities of age. So children under the age of 5 or adults over the age of 65 are always more prone, because with age, your immune system kind of gets weaker with time. And that's why even if you don't have any comorbidities or other medical problems, being over the age of 65 itself is a risk factor for you.
And one final question. Like you said, every year there's a different kind of an influenza. It's mutated. Are we facing a tougher influenza every year? Is it changing to be worse, or we're facing the same thing but in a different way?
So thankfully, I don't think it's getting worse or better. It's been the same throughout the years. You do get some epidemics or pandemics here and there, but usually it's the same. Strains differ a bit in terms of evading your immune system. That's why you don't develop immunity for good.
You see, the reason I'm asking is because I actually got the influenza. I don't know if it was A or B. I wish I've heard this podcast or watched it before so I can take the vaccine, but that's what I'm going to do after this podcast. Thank you so much, Dr. Yanal. It was a pleasure meeting you today at Khaleej Times.
Thank you. It's my pleasure. Thank you.